Well, I think that there is a loud minority, I would say, who have children, unfortunately, that don't respond well to the cast removal. It's funny, but you're always told, oh, it's great, you're having the cast off. And I remember that first time when she was 2, and we were told the cast can come off now, being delighted. And off I trooped to the hospital with Sophie with trousers and tights and all sorts of things that she's not been able to wear for weeks and weeks and weeks. And yes, she can wear them now. And I don't think I've ever realised how traumatic it was, actually, that cast removal when she was 2. She was very, very traumatised, and they were concerned for her because they'd not had a child cry so much after cast removal as well. And we went home eventually, and she just cried solid for 3 days. And we said we had to ring the hospital, and they readmitted her, and they did pain management with her, and they gave her some physiotherapy in the pool, some hydrotherapy actually there. And that's not normal for having a 2-year-old in the cast, but of course Sophie isn't a typical child, and we were very grateful that they did give us some hydrotherapy, because it certainly helped ease the pain for her. And I think looking back at it now, it wasn't just physical pain, it was the trauma of having the cast removed, which had been there comforting her, very close to her, very cosy. She'd got used to it, and I think it was a very traumatic experience for her to have it removed. And then on top of that, it was very painful. And we didn't actually probably get her back to where she was before, which was sitting up and crawling, until a year after the cast was removed, and nobody told us that. Nobody told us that it was going to be like this. They all said, oh, she'll be fine, she'll be up, she'll be back to normal within a few weeks. And that wasn't the case with us. In her second cast, of course, we were prepared, and we were pre-arranged for her to have physio after cast removal immediately, so that she could have a mixture of hydrotherapy and land physio to try and help her through the problem that she had experienced the last time. So yeah, it was much more traumatic than we thought, and this time it was still traumatic. She still cried a lot, and she still had a lot of pain issues, but we worked through them, and eventually she was able to go through her physio without experiencing pain. But it did, I have to say, take about 8 to 9 weeks after. Yeah.
And you can't remember cats.
Yeah, you can't tell her why it's been removed. You can't explain anything that she would understand. Again, all you have to do is just be there as a comforter and try and get her to adapt to the new situation. But no, it's not actually easy to say to her, you know, look, this is fine, you now need to move your leg, because she doesn't know how to move legs. So she doesn't understand that. So it's all about getting over that side of it. You have to almost force her to do stuff that really mentally she's not really caught up with. Yeah. Sophie came out of her cast in February 2009, and I would say that now she's probably the best she's ever been. We had to do a long program of physio. We did a lot of leg stretching and standing in the standing frame. We did a lot of hydrotherapy. We bought her a trike, a special needs trike that she could use to try and build up her muscles in her legs. And she went out on that when it became summer. So with that, she learnt to be able to pedal. So she wasn't able to do that before. She was also, after she came out of the standing frame, we started a process of trying to get her to take steps, and she can take steps while you hold her hands. And we've also got a little Zimmer frame for her, and she can now use that independently. You still have to walk behind her to catch her, because her balance isn't as good as it could be, but I would say that the amount of progress she's made has been fantastic since she's come out of the cast. The operation itself was a great success. Everything looks as though it's all in place, and she really does try hard to do stuff. She really wants to try and do stuff, which is really helpful to us, because we can encourage her only so much. But at the end of the day, she has to want to do it, and that's been fantastic. We've done some really good things since the operation, and things do really get much better each day as it goes. So we're very pleased with the progress she's made, and she's been very, very brave through all the operations she's had. Yeah.
Remember, you are not alone. When you want information, advice and support, our helpline team are here to help you. No matter how big or small your concern, please email or telephone our helpline. Get instant access to information 24 hours a day via our website, where you can download our advice leaflets. You can also visit our online chat forum, which provides a fantastic resource of helpful tips and practical advice written by parents who are coping with a child affected by hip dysplasia.